Well, welcome back. All week long, we've been featuring topics related to Women's Health Week on the show and why it's important to keep up with your routine health exams, screenings during the COVID-19 pandemic.
Joining us now is Dr. Yesenia Blancas, an OB/GYN with UT Physicians and fellow of the American College of Obstetricians and Gynecologists, with more on the precautions they've been taking to protect patients. Doctor, welcome to the show. And first of all, let's just chat about some of these precautions you're taking. And I understand that you've been hearing from some of the patients, they may be a little hesitant to go through with some of these routine appointments, but the routine appointments are really about catching serious medical issues before they become a problem, right?
Yes. Hi. Yeah, thanks for having me today. I'm so glad that we're taking time right now during National Women's Health Week just to kind of encourage women that taking care of their health is still very important even during this time. So I just want to reassure women that when they do come to our office, that we have taken several precautions here at UT just to make sure that we're keeping them safe as well as our staff safe. When they walk in, for example, they're first getting a temperature check. If they don't have a mask on, we're providing face masks. And then they're being guided into our waiting room, which is also following social distancing right now. We're doing even more bigger efforts on keeping everything sanitized and getting our patients into private rooms as quickly as possible.
And Dr. Blancas, I know this is so important. If people have a well women's check scheduled or saying that they're going to be due for that, or a mammogram or something routine, it's important to keep those, because I think what happens is life gets in the way and all of a sudden it's 12, it's 18 months later. Even though we're going through what we are going through right now, these appointments, if you're comfortable to go, should be maintained, correct?
Correct. Yeah. Even before all of this, it was so easy just to get busy with life, with your kids, with work. And then before you know it, 2 years go by and you haven't had your mammogram that you meant to get done. So this is a good time to just take this time to make time for yourself and make those appointments that are so important, because things can be prevented. And even if we catch things early on, it's much easier to treat them before we wait for the disease to get more advanced.
And Doctor, obviously family planning is a very personal process for folks, and for people out there who may have considered starting a family or adding to their family, what are the things they really should be keeping in mind during this time?
So I would encourage patients to make a visit with their OB/GYN right now for a preconception visit. At those visits, we'll focus on their health care at that moment and make sure that they are taking the proper medications and prenatals that they need to be doing. And obviously also talking about the COVID-19. The good thing is that right now we don't believe that there's any higher risk to our pregnant moms when pregnant, and that there has not been any signs of an in utero transmission to the baby, and even during delivery. However, obviously after the newborn is delivered, there is that chance of the baby being exposed in case families are not taking the proper precautions.
And these are all really great points to remember, too, that all of these things are happening. And if you have questions, you have telemedicine, there's a way to communicate with your doctor without actually going in. But if you do have that appointment, how can we expect that to be different today?
So the biggest difference probably is that, well, we are still allowing patients to do telemedicine if they're more comfortable with that. But in the office, so many times for those visits, you want to come in with your significant other or with your family. And so the main difference is that we are only limiting that appointment to the patient by themselves in order to be able to continue practicing social distancing and keeping everybody in the office safe, as well as our patients.
Doctor, the CDC has said that pregnant women have the same risk of contracting COVID-19 as any other adult. But so for someone out there, and I know there's new information every single day, if someone is currently pregnant, what are the things they need to keep in mind to protect themselves?
They need to do the exact same thing that everybody else is doing a lot of good hand washing, wearing face masks when going out in public, trying to perform as much social distancing as possible. But as of right now, we don't suspect that our pregnant moms are at any higher risk. However, if you do happen to be pregnant and have multiple medical issues such as heart disease or diabetes, you might be at a slightly higher risk of having more significant complications with the virus in case you do become ill with it.
And what about for those who are delivering during this time, too, when we're talking about, I think it's important to mention breastfeeding, because for a lot of moms, this is very important to them, and this can still be done.
Correct. As long as moms are practicing hand hygiene, and if they're worried that they might be having symptoms, getting seen by their doctor immediately, just to decrease that risk of infecting their newborn.
And doctor, we're just about out of time, but I'm seeing here on my notes, UT physicians providing multi-specialty care, 2,000 clinicians certified in more than 80 medical specialties. I mean, I feel like one of the big takeaways here is that in addition to a pregnancy or potential pregnancy, if someone is needing care, not just routine prevention, but urgent medical care, this is not the time to be putting that off, correct?
Correct. So if you're already about to get an evaluation for something going on, or even getting scheduled for surgery, right now is the time to continue making those appointments, so then your doctors can still continue to take good care of you.
Dr. Yesenia Blancas, thanks so much for joining us from UT Physicians. We appreciate the insight and the conversation today. And to learn more, you can visit their website at utphysicians.com, or you can simply call 888-4UT-DOCS. That's DOCS, and we'll be right back.